Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article Is Your Doctor Thinking? Part 4. If you go to your doctor and he orders some blood test, and one of the liver tests called AST, value is, let's say, 41, and the laboratory's range is 40. And he doesn't tell you that this test should be repeated. If it is still positive, it could be very significant. If on the repeat test, the laboratory test value falls within the normal range, we don't have to worry about it. If your doctor doesn't do that, I'm afraid your doctor is not thinking independently. Your doctor is not thinking for herself or himself. Your doctor is not paying attention. Your doctor does not care in this specific example. Your doctor may be very compassionate, he may be very reliable, he may have the world's greatest bedside manner. That's besides the point. As long as I continue to see patients where their low-grade abnormalities in the liver test are completely neglected by the doctors, I think I will continue to bring cases like this to encyclopedia. I would not like any viewer of this encyclopedia 5 years later, 10 years later to come down with cirrhosis of the liver, complete scarring of the liver, and become seriously ill and dysfunctional. 1968. That was the year that I first performed an autopsy and found cirrhosis of the liver, scarred, shrunken liver at autopsy. I thumbed through the chart because we were taught to thumb through the charts and come up with our own pathologic diagnosis before we open anybody's body on the autopsy table. So I had thumbed through the chart and there was no reference of any liver disease, let alone cirrhosis. So this came as a surprise to me. Later on, I called the doctor and asked him if he knew the patient had cirrhosis. Remember 1968, those were pre-scan days. Those were the days before everybody had a liver ultrasound, which is an excellent test. It took me another few autopsies, probably another year or two, when discovery of cirrhosis at autopsy was the first detection of the existence of cirrhosis of the liver. And it is at that time that I recognized, when I closely examined their laboratory profile, that there were two tests which were abnormal. One was the AST test. It's an enzyme test. There's a separate program on it. The second test was an increase in gamma globulin protein. That's also part of your routine test, and also there's a separate segment on this encyclopedia. But let me come back to this channel. I recognize that I would be harshly criticized by some people from the title of this channel, Is Your Doctor Thinking? I recognize that some people who have had excellent experience with their doctors might be offended by this. I recognize that some people might even think this is Dr. Ali's pathetic attempt to self-congratulate himself, self-aggrandize himself. In fact, some people might even call it professional misconduct or professional display of absence of ethics. Some people might think that it is unethical for me, for an encyclopedia which is free of cost, meant for viewers of all regions of the world, that I am making a statement like that. My answer is, as long as I continue to see people whose liver disease is ignored because their doctor are too lazy to think about it, or they do not think for himself, or they are following the standards of medical care. Remember now, in the United States, standards of medical care are not established by doctors, they are established by drug companies. If you think that this is an exaggeration, there are editorials written in the New England Journal of Medicine, Journal of American Medical Association, Lancet, British Medical Journal, where the chief editors have said that these trials that we are publishing, they're controlled by drug companies, not by the doctors whose name appears on them. Now remember, the results of these trials are being used to set the standards. Children's Health Corps was funded and founded by Talat, my wife and I, some years ago with the mission of spreading authentic information for children, especially focusing on issues of nutrition, environment, and stress. But then as I continue to do more work on children, I realized that if the mother is toxic during pregnancy, she is living on antibiotics, sugar, and caffeine. She has nocturnal hypoglycemia, nocturnal hyperglycemia, nocturnal adrenergic crisis, nocturnal neurotransmitter disruptions. Then I cannot just keep talking about the issues of the children without looking at the toxic womb state where the unborn child started developing serious problems. Please support us. Forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Visit our website, www.kids123.org. If you wish to help us more with your creative ideas or with your other forms of support, on our website homepage there is a link, how can I help? Click on it and we'll give you concrete suggestions how you can join hands with us in this cause, which I think you will consider is worthy. Until you meet again, may you be gracious, graceful, and generous in your spirit. Thank you. Thank you so much.